This is the problem you have with being the oldest guy presenting, is you have to come on stage with an IV. So I have an active IV in my arm. This is an infusion pump that you'll typically see in an infusion center or a hospital, and this is a monitor. That's a PhD that works for me. I couldn't find an MD, so I had to get a PhD instead. But anyway, I have an active IV going in here. And I'm going to start off just asking a question here. How many people here, raise your hand, how many people here use an iPhone? Not Android, iPhone. No Androids. It's a big market, right? It's 1.4 billion. Do you know how many people in the world get IVs right now? About 1.2 billion a year. In the United States, we sell about 300 million IV catheters, which is about the same as the population, which is quite crazy. And things can go wrong with them. So what ivWatch does is we have a patient monitor. This does hurt. I will tell you, this hurts. So I actually have an infusate coming in off this syringe pump into my arm right now, and this is an ivWatch monitor. And what we do is we actually have a small sensor that is monitoring to make sure that that infusate is going into the vein. And you ask, well, why does that matter? So if you actually search on IV extravasation or IV infiltration, these are the images you find on Google. And these are now being censored because people don't want you to see them. I want to tell you a story, Melissa Williams. We just filmed this last week. I want you to notice her hand. That's an amputation it's called a ring finger amputation. And basically, over the course of the last 7 years, Melissa's got 1 permanent disability, 2 lost fingers, 27 procedures, 7 painful years, 97 hospital nights, 153 therapy days, $500,000 in lost wages, and 1 son who has Asperger's disease lost the mother he knew. So our vision at ivWatch right now is actually to become the IV safety company. And what you see here is this thing detected probably in about 1.5 cc that the drugs are not flowing into my vein, but they're actually flowing into the tissue outside the vein. And the way this works is we inject light into the tissue, and we look at how that light is reflected back. We do different colors, and we can tell when drugs are starting to show up that are not supposed to be there. So just a little bit about ivWatch. We have 69 global patents right now. We're in 12 countries. The company we're kind of drowning right now a little bit. We have about 80 evaluations scheduled for this year. We have had 12 regulatory audits. It's cleared by the FDA, and we have about 50 employees. We've raised about $90 million to build this medical device company. We do all of our own manufacturing here in Virginia. We do all of our own R&D, and we ship all over the world right now. It's becoming standard of care in many major hospitals, and so it's an incredible opportunity. Every one of you here tonight will need this product someday. Every one of you here tonight will get an IV, and it may go bad, and it may cause damage that you don't want to have happen. It may happen to you. It may happen to a loved one. So what's the market opportunity? I put down here $1 billion. This is just the United States. So where are the countries and the geos that we're in right now? It's about $3.4 billion opportunity. So we are currently in a growth round. We're raising $25 million, and that's ivWatch.